I wanted to start and I was muted, so that doesn't work. Hello, everyone. Welcome to today's session. My name is Thilo Panzerbieter. I'm the chair of the German WASH network, consisting of 28 NGOs working in the field of WASH globally. And we're co-convening this session with the German Network Against Neglected Tropical Diseases, an alliance of actors from civil society, research and learning, private sector, and politics. And with GIZ, German Development Agency, I think that needs no introduction. The session title is, as you see here on the screen, Overdue Alliance, NTDs, and the potential of WASH. I'm excited about the topic. I hope you are as well. I'm excited about who's here with us today. And let me assure you, we have an excellent round of experts with us. And you as participants, high respect to all of you that are going to these online sessions, paying the entrance fee to come in. As a result, this year, I think Stockholm has not as many participants, but for you, I think it's an advantage. It's your chance to interact lively, to pose questions later. And as a result, of course, we'll value every one of you even more with being able to interact later on. Let's move to a housekeeping slide. Maybe just a reference to the speakers. It would be great if you could mute yourself and only unmute when you're speaking. To the participants, do feel free to use the chat. I saw some of you began to do so. Introduce yourself, connect with each other. It's also the place to pose your questions to the speakers later. And I'll explain that in a little bit more depth later, how we want to do that. We'll do our best to make this as interactive as possible. A quick warning to everyone, this session is being recorded because that's one of our attention to also reach out to people beyond this session with our valuable discussions. So I hope you're all fine with this. If not, this is the chance to leave. And I do have to inform you that we've been told that some World Water Week sessions have been hacked and sort of the sessions disturbed. So just to let you know, should this happen, we will have to sort of terminate the session. And in this case, we'll do our best to find an alternative slot and keep you updated. That being said, let's be optimistic that won't happen and look at our agenda for today. Apart from my quick welcome, we'll hear some introductory remarks by Dr. Morgenroth-Klein. After that, we'll go into the panel discussion with participant interaction, with Q&A. And then we'll have a call to action and sort of summarize our key messages today and closure of this session today. So that's the outline, looking, like I said, to have as much interaction as possible. Before I hand over to our opening speaker, in a second, I'm interested sort of in just who's now in the room, the participants. So this is our chance for a short first interaction, just a short slide for those of you that are new to this format, to tell you where. Can we have this next slide, please? You should see on your screen, there's a sort of box on the right with some tabs attached. And if you hit the tab that says polls, here you will find questions that we'd just quickly like you to answer. The one thing is, from the people that are now here in the room, we'd like to find out from you what's the angle at which you're sort of addressing the topic that we're discussing today. So you'll see two polls, and you can say participate now and then choose the appropriate selection and hit submit. That would be greatly appreciated if all of you could do that. And then there's a sort of second question, which is just intended to get us thinking about the topic that we want to discuss today, so that we can sort of see what people's knowledge is in terms of the topic that we're about to discuss. So I hope everyone can find those options on the screen. We'll just give it a short second, and then we'll have a look at the results to give us an idea. Okay, I think we're pulling up the results. Drum roll. Slow platform. Okay, here we have it. So we have, we do have a majority of participants from water, sanitation, and hygiene, some from One Health, poverty-associated infectious diseases, environmental pollution. So we at least have all those categories covered, which is good. Wasn't sure whether that would be the case, and hence, and I see not everyone has answered, but at least we do have sort of the different areas covered, which is good and great for our sort of exchange and discussion later on. Maybe a quick look at the second question, if possible. Coming up. This was the question on what can WASH actors do to reduce the burden of NTDs. And I see it's sort of done in percentages. Would have been nicer, I guess, in sort of number to see whether everyone, whether everyone hit all the buttons. We do see that, obviously many in the room with good knowledge that, of course, all four do have an impact, but we can see that there are small gaps here and there. Not everyone actually hit everything. So looking to fill some of those gaps with our exchange today, and to learn from each other, to inspire each other in our dialogue, and making the neglected tropical diseases a little bit less neglected with our session today, strengthen some cross-sectoral collaboration. And for this, we have a perfect speaker to help us set the scene. Our introductory speaker today, Dr. Wolfram Morgenroth-Klein, excuse me, from the Federal Ministry of Economic Cooperation and Development, BMZ. He's the head of Division 101, called the Special Initiative Pandemic and Global Health, Pandemic Prevention, One Health. An economist by training. Dr. Morgenroth-Klein is located in Berlin. So are we. So I'm sort of handing over to you across Berlin. The floor is yours, please. We look forward to hearing from you.
Yes, thank you very much, Mr. Panzebeter. Dear colleagues, ladies and gentlemen, it's a pleasure to welcome you to this session, which is co-convened by GIZ, the German Network Against NTDs, and the German WASH Network. And in this session, experts will provide you with insights on the importance of WASH interventions and the opportunities presented by the One Health approach to fight against poverty-related diseases such as the neglected tropical diseases. I guess most of you, since this group is not so huge, know already what NTDs means. It's a diverse group of 20 diseases which are classified by WHO. And many of these diseases are of infectious nature and could be prevented. Why are they neglected? Actually, it's the diseases that are neglected, but more even the people that have them. It's mostly poor people in poor regions of poor countries that have a high risk of having infections of NTDs. And this is why, as Ministry for Development Cooperation, we feel it is necessary to put much more attention on these people and on these diseases. It's a true vicious circle, in my view. On the one side, a disease makes poor people poorer, and on the other side, poverty will leave a lot of room for infections and under unhygienic conditions. The WHO has provided us with a roadmap to end the neglect of NTDs until the year 2030. This roadmap and its supporting technical documents highlight the need to enhance integrated and One Health approaches, as many of these diseases have an intersectoral component. Tackling NTDs appears to be an ambitious task, even given the even complex combination of topics and approaches. But today, we actually want to provide you with some ideas and some solutions. The panelists will share an ample real-world example and good practices from German development cooperation, but also from the local and the global scale. To start with this dialogue on tackling NTDs, let me share the perspective of my ministry. Why do we consider that the combination of WASH measures and the One Health approach is key to fight against neglected tropical diseases? In a nutshell, we believe that the One Health approach offers opportunities to mitigate health risks through prevention and to tackle complex challenges such as infectious diseases, antimicrobial resistances, and neglected tropical diseases through early detection and through interdisciplinary cooperation. And it's always the cooperation, especially between human health, animal health, and also ecological health or ecological intactness, which seems to be decisive in order to get a real early stage preventive approach here. This approach has already been recognized, and we feel there is a good movement towards recognizing it even more. We had the formation first of the tripartite. It's now the quadripartite between FAO, WHO, the UNEP, and the new World Organization of Animal Health, WOA, which has been established, and also only 1 year ago, the One Health, the high-level panel, the OLAP One Health high-level expert panel, which has had a first definition, more modern definition of what One Health would comprise. One of the goals we set for ourselves in the BMZ is to better anchor One Health, and therefore we have already defined 1.5 years ago one first strategy, and we are in the middle of implementing it. I will describe some of the steps or some of the measures we have taken and are still taking. First, we believe that intersectoral relationships must be deepened, and that we must support the strengthening of institutions, of networks. And I believe that this seminar here is also one of these efforts. Second, we want to engage with and to support partners in multilateral and bilateral NTD programs. In fact, we have done so for many years already. For example, in the TDR, in the WHO Special Program for Research and Training in Tropical Diseases. Third, we want to expand this also with partners such as WHO, for example, in the Aspen program in Africa, together with WOA, together with UNICEF. And of course, there are many other examples. We for example, cooperate with the community of Central Africa on the One Health approach. We have clinic partnerships in different places, in different regions, among them, of course, African regions. Or we have also strengthened an intersectoral program of combating rabies in Cambodia, Cameroon, and Namibia. And we have also been one of the first donors as Germany to sign up to the Kigali Declaration on Neglected Tropical Diseases. So we have a long-standing commitment in this, but we also have a long-standing commitment in the water and wastewater sector. And it's not only that we have still activities ongoing in more than 300 projects, but that we feel that the link between health and water is becoming ever more important than before. And here, one of the key subsectors, if you like, is WASH, of course. However, it's important to note that both WASH and NTDs initiatives will and could and should benefit from this intersectoral collaboration, from this interdisciplinary approach of environmentalists, veterinaries, human medics, and even social scientists. For instance, we currently observe water scarcity and changing geographical topography leading to more infectious diseases in Central Europe as a result of climate change. Similarly, we have clearly recognized that the need to better monitor the effect of agricultural water use on human and animal health is becoming much more important. So there are many examples where water, hygiene, health, and also sustainability or sustainable production go hand in hand. And I hope that this meeting will help to find some additional inspiring examples in order to establish the cooperation and the synergies we need in order to fight against NTDs. On behalf of the BMZ, therefore, I thank you for your attendance to the session, and I wish you a fruitful exchange during this meeting.
Great, thank you very much, Dr. Morgenroth-Klein. Virtual applause from me in clapping. Others are clapping with their hands in the chat. Thanks for setting the scene so clearly. Your introduction reminder of what are the NTDs, the global context, but also your call for more collaboration, which what we're here to do today, and the insight how German development cooperation links NTDs, WASH, and One Health. Thank you for your commitment and your time for setting the scene here today. Thank you so much. And with that, we can segue to our panel discussion. It's time for me to introduce our 4 panelists and experts to you. And Dr. Morgenroth-Klein, feel free to stay as long as you can to capture some of the discussion. I'm fully appreciating your presence. And I ask the panelists to please turn on your cameras as I introduce you so that we can, or feel free to do so now that we can see you. We have 4 excellent experts with us, Dr. Pauline Ngina Winzi. I hope I'm pronouncing your name correctly. Pauline is the technical officer for Schistosomiasis and soil-transmitted helminths in the expanded special project for elimination of NTDs called ESPEN in the WHO region for Africa. She's serving also as the focal point for One Health in interim, has 20 years of experience working in NTD research in Africa. And prior to joining WHO 4 years ago, she was chief researcher and head of the NTD research unit at the Center for Global Health Research at the Kenya Medical Research Institute, founding chair of the African Research Network for NTDs until 2017, and therefore welcome and a warm applause to you. Our second panelist, Dr. Ayman Ahmed, Sudanese national, presently working in Sudan for Vétérinaires Sans Frontières Germany, veterinarian and microbiologist by profession, 10 years plus experience in veterinary sciences, teaching, research, humanitarian development sector. Currently a Sudan country program manager with VSF Germany. So welcome to you, and also applause to you. Thank you very much for being here. Our third panelist, Mr. Ahmed Bekere, German Leprosy and Tuberculosis Relief Association in Ethiopia. With this organization, one of our German WASH Network partners, he's the Disability and Rehabilitation Team Leader, holds an MA in Sociology and Social Administration, has 17 years of work experience focusing on rehabilitation, humanitarian and development related projects. Welcome to you also. Applause, great that you're here. And last but certainly not least, Mr. Baridoué Badon. Dr. Baridoué works for the private sector company Merck. He leads the Access to Water program in the Global Health Institute of Merck, responsible for driving strategic partnerships and the implementation of access to water projects for the Institute. Prior to joining Merck in 2019, he worked as a physician in private and public hospitals, as well as with global health organizations, holds a medical degree, an MSc in healthcare management and an MBA. Welcome also to you. Welcome to all four of you. Thank you very much for joining us today in the discussion. Before I engage with you and we have our discussion, I would like to quickly just skip to the slide again to explain how we want to take questions, because we'd love to have interaction. It's not the most welcoming platform for us to do so, because I think you cannot unmute yourself, but we want to take every opportunity we can for you to pose your questions, and I will vow as the facilitator to make sure I take your questions ahead of mine. So as we're going through this and as we're hearing from our panelists, if questions come to mind, please do use the chat function. You will see it in your Pathable screen on the right side. If you hit the chat tab at the top, you will see that there's an opportunity for you to start typing and to send a comment, a question, and at the same time, we would like you to be able to appreciate questions of others. So if someone has posted a question you really like, please do click the reply button. You see it here, basically at this one comment below. So you can go on the little reply button that's listed for comments that others have made, and then you can reply. If you just want to say, great question, I agree, please do type that there. We'll see it by that little reply counter. You see it at the bottom on the left, sort of going up on the shared screen. And hence we can sort of, we can gauge which are the most urgent questions if hopefully you engage in great depth, and we'll have lots of questions from you. That being said, let's now, I think the shared screen, we could then stop, thank you. And then, let's head into our discussion. We'll jointly try to shed some light on how the WASH sector and its efforts to combat the NTDs with a One Health approach, how that can be useful, what are the challenges, how can it be done? And we'd like to dig into the issue not with long presentations by these experts, but rather take it a question at a time, allow the participants to come in. And I certainly have lots that I want to know. So let me just begin maybe with a sort of first set of questions to our panelists, being quite specific to sort of the work you're doing, which will give us a little idea of your respective work and projects. So I'd like to start with Dr. Mwinzi, and perhaps welcome again. You can give us a short idea of what role WHO Afro is playing in enhancing WASH and the issue we're talking about today.
Thank you very much, Hiro. As you introduced me very kindly earlier on, I'm with ESPEN, and ESPEN is focusing on the 5 leading NTDs in the region. Schistosomiasis, STH, LF, onco, and trachoma. And so, over the past decade, despite distributing over 2 billion tablets in mass drug administration, we recognized that WASH implementation was very low and that we cannot achieve interruption of transmission for any of these diseases unless we really implement WASH. So within the expanded special project for elimination of NTDs, we are supporting countries, and I'll present 3 ways in which we are doing that. And one is in the data sharing, ensuring that countries have some data to start with. We know that this data is scarce, but we're starting off with the data that we present on the ESPEN portal, which can be found on espen.afro.who.int. And there you will find modeling data that is based on Bayesian models that's being developed, from lots of indicators on health that are related to sanitation. And we hope that this data will help countries that do not have sanitation data to begin with. And for countries that have some data, and we have, in my second point, supported countries during mapping of neglected tropical diseases to include a tool, a qualitative tool that then allows teams that are mapping at community levels to observe what's happening there and also ask opinion leaders about the sanitation situation, use and availability in those settings. And we provide this support through our data collection model, where we use a tool called ESPEN Collect to support our NTD programs in the region to share this data directly with us and provide training to data managers in the countries. And our third approach, as I mentioned, the uptake has been quite low, is through the NTD Master Plan, supporting countries to ensure that they use the global strategy on WASH and NTDs 2021-2030 that we just launched recently, and help use the document to help them mobilize all line sectors at country, bring them to the same table, plan together, bring the resources from all those line sectors where possible, begin to discuss the indicators at country levels, and ensure that this plan is included in the NTD Master Plan and all stakeholders are on board. And we look forward to then being able to see what the countries have in all of these NTD Master Plans, which is an ongoing activity. I'll leave it at this for now, and I'm happy to clarify further. Thank you so much.
Thank you very, very much. Feel free to type the link that you just mentioned, perhaps into the chat. I think that will be useful for participants to see. And if anyone has questions, please, do post them in the chat. And if possible, always write an @speaker if it's sort of aimed at single speakers. With that, I'd like to bring Dr. Ayman into the discussion. And I'd like to find out what are some examples on how the integration and coordination of WASH, FSL, and health nutrition activities work in your programs, so that we get an understanding of that.
Good evening, everyone. I hope I am audible.
We hear you. We
Thank
see
you.
you and we hear you. So looking forward to hearing from you.
Thank you so much, and thank you for the presentation. When it comes to program, I think I might bring some insight from the field. Specific to Sudan context, we have been employing One Health approach in recent few years in our programming. So we have been leading consortiums in different areas in Sudan, integrating WASH with health and nutrition, as well as with food security and livelihood activities. And we are engaging partners with expertise. Each partner is leading a thematic area, but at the same time, we would have a coordination mechanism or a coordination structure to ensure that these activities are well integrated. We have been working on projects An example is a project in South Kordofan State, which we implemented in 2019 to 2020. The project duration was 20 months. It was a consortium project with international partners, some experts in health, World Relief, International Sudan Program, and also international aid services who have expertise in WASH, water sanitation and hygiene. And we brought our experience and expertise in food security and livelihood. This project was well coordinated. The three sectors were very well coordinated. One of the impacts of the project was that some of the targeted areas were deprioritized for receiving humanitarian assistance in the following round of funding. And also it was, this approach was adopted and funded for also 2021 and 2022. Finally, we were able to even solicit funds from BMZ to establish a longer-term resilience building program adopting the same One Health approach, which will continue for 4 years. Also doing the same, but at the same time, looking at the humanitarian development nexus when it comes to WASH and health. So, yeah, thank you.
Thank you very, very much.
Thank you so much.
Yes, thank you so much. We could hear you perfectly, and participants are clapping. So I think that, yeah, that struck a note with the participants. We'll see if questions come in for you in a second. Dr. Baridoué, I'd like to hear from you. What are the strategic partnerships that are currently going on within your project? We all realize we need to work together better. Partnerships are important. What can you tell us about your work and how the partnerships that are currently ongoing? Thank you.
Hi, thanks so much, Thilo. Yeah, so I work with Merck, and we actually employ an integrated approach towards the elimination of schistosomiasis. We actually do tablet donation to WHO and to Pauline especially, right? Yeah. So since 2007, we have donated over 1.2 billion tablets of praziquantel, and then these are given to over 47 countries. Then we do not just stop there. This has really enabled about 600 million children rather to have treatment and for schistosomiasis. We don't stop there. What we also do is to also do advocacy and partnerships. We focus also on the complications, which is female genital schistosomiasis and in women's health. We are currently working on an oral dispersible tablets for schisto, right? That's pediatric praziquantel. And we don't also stop there. We also develop new molecules to help in this regard. And then we work toward diagnostics too, to create rapid diagnostic test kits that would enable schisto to be effectively diagnosed during mass drug administrations, to monitor or not just to waste, or I won't use the word waste, but to know those that need drugs or not. And then coming to the water sanitation and hygiene, and we have different projects ongoing. We've worked in Ethiopia for a while, but more specifically now we're in Ghana. And what we first of all did was to do an institutional assessment of what WASH looks like in the country. So we selected about 6 regions following the ESPAN's data on where the prevalence of schistosomiasis is. And together with World Vision, we're able to identify 6 regions where they work in and where we could work together. And we assessed 197 healthcare facilities. We've also done 34 focus group discussions to look at the willingness of people to pay for water, their knowledge, attitudes, and practices towards NTDs, and also generally how they think about WASH, right? And interestingly, we had some results which were trickling in because this assessment was done this year through World Vision, and surprisingly, a huge number of people in the regions, over 44% of healthcare facilities, so to say, do not have access to clean water. 44% in where we did the assessments, and that's access to improved water in the healthcare facility. So if you want to look at the people that actually have access of pipe water in the healthcare facilities, in 197 healthcare facilities, only 17.8% of the healthcare facilities had that. When it came to hygiene and functional hand sanitation available in the area, we had 28% having that in 197 healthcare facilities. And we also looked at the quality of water, in the region. We did quality water testing for 98 of the healthcare facilities, and only 74% of them were free from E. coli contamination. So this leads to more infections in the healthcare facilities and so on. And why are we doing this? We are doing this to really look at through a holistic approach, what's really happening in the region, because this would help in pandemic preparedness, areas where people, there's a flooding and so on, or there's even a pandemic like COVID, right? Healthcare facilities will be able to be well armed to deal with the situation. And then also in the community, while we're doing this assessment, it was for us to understand what the situation is like, to do more decision making using data, not just go to a community that really doesn't need it, and to also help with resource mobilization. What we've also done is we've implemented WASH at the moment in 15 communities so far, in the regions, trying to more partner and solve the problems. So we are working with the Mac Family Foundation, which has funded our project, and also Branded Global Care EV in Munich. They have a corporate social responsibility foundation aspect that also works on WASH. So we've worked together to co-fund WASH, in Ghana, and then we are really very open to solve most of the problems that we are finding on the field. So, we are going to publish this result, and of course, anybody that is interested to know more, because the results are trickling in and we are getting to see in reality what the problem looks like. We are very open to share with any interested partner. Thank you.
Thank you very, very much. Yeah, some shocking statistics you mentioned. Of course, also here, yeah, any information that can be shared. If you have anything to write in the chat, please do. Questions, feel free to pose them, dear participants. So now we'll go over to Mr. Ahmed Yusuf Bekere. And from you, obviously, we heard the challenges are huge. What are, from your perspective, what are existing national policies and strategies related to One Health to fight NTDs? Can you shed some light for us on, where's the starting point in sort of, policies and strategies?
Okay, thank you very much. Ethiopia is one of the countries where there is a high risk of zoonotic diseases, and every year there are thousands of deaths resulting from these zoonotic diseases, and there is an understanding at national level these challenges, and in order to revert this risk and problems, Ethiopian government prepared a national strategic plan, which was prepared in 2018. This strategy laid down the measures that help to adapt the One Health approach in order to fight the challenges and risks faced by the zoonotic diseases. But the challenge is that these strategies are not being implemented as per the plan because of various reasons. One reason is there is no enough budget set for this plan to be implemented. Due to budget shortage, it's not being implemented as per the plan. And there is also poor integration between relevant sectors, especially the health, the human health, the animal health, and the environment. And there is also lack of communication between those sectors. Due to this, these strategies are not implemented as planned. The other challenge is the One Health approach is not institutionalized. This strategy planned to institutionalize the One Health approach in all relevant sectors, but that is not realized. These sectors, health sector, don't have a unit that deals with One Health approach, And the livestock ministry lacks that unit that deals with the One Health and the coordination issue. This is the second challenge. There is also limited awareness within the community concerning the One Health issue. And these are the challenges and the gaps. For the One Health to play its role in helping overcome challenges faced by zoonotic diseases, those strategies and commitments need to be realized with assignment of enough budget for their implementation and capacity of the regions. Those policies or strategies are already prepared at national level, and they are not adapted by regions. That need to happen. The regions need to adapt those strategies and apply it accordingly. And the capacity building should be there for the regions and for local government sectors. Also, institutionalizing the One Health approach is also important for the One Health approach to bring the required change. The Ministry of Health need to have a separate unit within its structure to deal with the One Health issue and issues related to coordination. And the livestock ministry also need to have a sector, a separate unit under its structure, which deals with One Health, and the same with the Ministry of Environment. And also, as there is low awareness within the community, we need to work on raising community awareness on the risk involved in interaction between human, animal, and environment, and also about the sanitation issues. This way, I think we can benefit. If this happens, the country can benefit from the One Health approach in reverting the challenges faced by the zoonotic disease. Thank you.
Thank you so much for the sort of first round of inputs, encouraging again participants to pose questions if you so like. Otherwise, I would like to look a little bit more sort of at the impacts of NTDs in their specific contexts. I mean, some of you have alluded to this already. Dr. Mwinsi, what is the current impact of WASH on NTDs and their transmission in your region? Can you give us a little bit of insight into that, please? That would be great.
Thank you very much, Thilo, for that question. And I also want to start by appreciating very much the challenges just posted by Ahmed, which, you know, we very clearly also see from this side. And I'm very glad that he is able to bring those out so clearly from the national level perspective, which is one of the areas we very committed to support. Because if we have a plan in place that everybody has participated in, and everyone has been given a role and a target and a milestone, then you can expect that it will follow through largely, especially if resources have also been mobilized for the same. So we're happy to continue supporting in that direction. Among the diseases in the Aspen portfolio that we focus on, starting with schistosomiasis and soil-transmitted helminthiasis being those that are most affected by sanitation. We have seen that data collection, especially among these two, as I mentioned earlier, when we are conducting mapping, sentinel-site surveillance, can very much complement the information that needs to come forward for the two of them being very heavily affected by sanitation, especially when you consider for schistosomiasis that it has to do with direct contact with water and for STH as well. But we have also we also see the same for trachoma, okay, which has to do with facial hygiene, and where that is not a possibility due to absence or lack of clean water or inadequate clean water, then you'll see the correlation with where the disease are highest and where the sanitation is the poorest. And I've given in the chat area a link to our data sets on the WASH data. And I mentioned that this is based on models as opposed to actual sanitation data, which is a good starting point because we are yet to get all of this consolidated data. What my colleague from MAC, Dr. Badon has very well mentioned, that we're looking forward to seeing this kind of data and also coming to WHO for reporting. But a starting point with the data that we have on the ESPN portal is that it's presented alongside the disease maps. And therefore, you can actually pick the disease maps and layer them over the water sanitation maps. The sanitation maps show where there's improved sanitation or not, where there's open defecation, and you can be able to see what the correlation with the disease levels for the specific disease that is. And we also have lymphatic filariasis as well, which also is one of the diseases that is related to WASH. And we have of course, the larger department program at WHO for all of the NTDs. Of course, as our colleague mentioned at the beginning, WHO is listed up to 20 NTDs, and a large number of these, including the case management ones, are related to neglected tropical diseases. But with the strategy in place, the global strategy now for WASH and NTDs, and as supporting very actively now the technical support and the financial support for countries to have their own strategies in place based on this guidance, and to also have that very well reflected on the NTD master plans with milestones and targets, then we expect that these indicators can be very well defined at country level, and they can begin then to be coming to us, for us to be looking at what this data is, but more so that the data then helps the countries to move forward in terms of, where are you starting from and where do you go next. Thank you, and back to you, Thilo.
Thank you so much for that oversight. I hope many will click on the link later and take a closer look at what you're explaining. You mentioned also, the different health hazards that are existing in different locations under different conditions. Dr. Ayman Ahmed, could you explain what are some of those health hazards determined and responded through your WASH programs?
Okay, thank you so much. So some of the hazards which or the WASH concerns and related concerns and issues related to public health when we started integrating WASH into our food security and also with health and nutrition programs, where there have been acute watery diarrhea outbreaks in Sudan between 2016 and 2019, approximately 36,000 cases, confirmed cases of cholera, and also 800 related deaths across all Sudan states, including our operational areas. We also breached the epidemic threshold for malaria in 2019, with accounting for about 12.4% of all the diseases surveyed by the health partners in the country. This is in addition to other zoonotic diseases and vector-borne diseases such as Rift Valley fever, chikungunya, dengue. All of those risks determined that we needed to integrate water sanitation and hygiene within our programs, especially since we are livestock-based organizations. So, for example, water supply infrastructure to improve the accessibility to safe and clean water to people, chlorination of water supply has contributed to control us and other partners working with the same interventions to control the cholera epidemic and other epidemics in Sudan. Thank you.
Thank you so much for that insight, Mr. Ahmed Yusuf. I was going to come back to you concerning sort of the gaps and needs of your country. I think you mentioned you elaborated on that before in your first point. Is there anything that you want to sort of add to that? Maybe also relating to maybe some of the things that you've learned through your work, what direction is needed. You're muted still, or I cannot hear you.
Okay, thank you. As a GLR Ethiopia, we implemented a One Health project within Ethiopia, and we had some experience in the area, and we have also some challenges. So maybe I can share the experiences we developed, what we did in using a One Health approach, and then come to the challenges. GLR Ethiopia implemented two One Health projects and is planning to implement one health project, which is a multi-year and cross-country project together with Uganda. In Ethiopia, we implemented two One Health projects, one in Guji, which is to the southern part of Ethiopia, and the other one to the western part of the country in Benishangul region. Guji is an area which is highly affected by drought, and there is continuous shortage of rainfall. As a result, there is a high burden of waterborne and water-based diseases. And the communities in that area also depend on agriculture and pastoralists, and they have close contact with animals on daily basis. And there is a high risk of zoonotic disease. The other area where we implemented a One Health project is Benishangul to Ethiopia-Sudan border. In that area, there is a high deforestation going on due to the shifting agriculture and also due to the burden of refugees which are coming from Sudan and South Sudan. And we implemented a One Health project in the context of the humanitarian, context. For the humanitarian response, we provided food aid and livelihood support for the communities affected. And also we provide restocking, beekeeping, and irrigation activities. And parallel to providing the humanitarian and the livelihood support, we looked at health in a holistic perspective, where we try to promote human, animal, and environmental health. And also we try to interrupt transmission of diseases between human and animals by screening both animals and humans for diseases, and by treating humans and animals for any diseases. And we also promoted livelihood through climate resilient and environmental friendly agriculture. So this is what we did with the regard to One Health approach in those two project areas. By implementing these two projects, we are able to take down the One Health approach to the local level, to the community level. And we are able to improve the livelihood of the community with a better understanding of interaction between animals, human, and environment. And after our project, there is also a better understanding of the concept of One Health within the government structure and about importance of working together among different sectors. And with the One Health project, which is under planning, we are planning to duplicate those initiatives in other areas. While implementing these projects, the challenges we face is, one is the lack of awareness about the concept itself, and also the risks involved in the interaction of those, the animal, human, and environment. And the other challenge is about lack of sustainable structure, which supports that our One Health project. We organized various, for example, various committees or coordination committees from different sectors, like from health, environment, and also from the livestock sector. But there is no system that sustains that structure for long in order to bring the required result in the future. That is the challenge we faced during implementation of the project. Thank you.
Well, although you had those challenges, congratulations for what you're carrying out, and and how you're linking the different levels, or creating impact at such different levels. Dr. Badon, what you mentioned before sounded very ambitious, and hence I was interested in sort of finding out where does Merck hope to be in, what results will we see in 5 years? Take us with, let us join your time machine and look into the future. Where will we be?
Thanks so much, Tilo, again for the question. Yeah, we are very ambitious, but also very practical. And then results sometimes you have to compartmentalize what you see as results, right? So the first thing we want to do is to create advocacy. Once these results are out, we would want to share these results because they directly dovetail with the reports of WASH, and WHO, UNICEF, on the situation of WASH in healthcare facilities worldwide, where it says 1 in 4 healthcare facilities do not have access to clean water. And then when we do that, we're going to create an advocacy meeting with the ministries of health in each of these countries. In Ghana, basically with different NGOs and partners. And then for us, since we are lining WASH with NTD, which is schisto and other waterborne related diseases, we would want to create a 5-year strategy plan on how we can reduce the prevalence of schisto in selected communities. And you might also know that schisto works directly with people that have contact with water. For example, young children that are between the ages of 7 above, it can be very difficult to tell them not to go in or wade in water. Neither can you tell a farmer or a fisherman whose livelihoods rest in the waters not to wade in water, right? And so we would want to focus mostly on women and babies that usually go to these rivers to get water for household amenities. So we hope to see how we can create washing stations in the communities where they would not need to, to go to rivers anymore to do, all of these chores. And then we do random studies on people that have maybe urinary schistosomiasis, which is hematobium, and then implement these wash projects over a period of time, not only schisto, but also looking at other waterborne diseases, maybe 5 or 6 of them, as much as we can monitor. And then after 5 years of recurrent implementation, snowballing from community to community, we can come back in the 5th year to review the impacts to see, have there been any reduction in prevalence following our actions in those communities around schisto, livelihood of women, with so many indicators, and then we'll be able to see in assurance the level of impact. And then this acts as a very clear pilot, which can be snowballed or tested or implemented in a larger scale in different regions and so on. So we're ambitious, but also very, very practical in this approach. And then we'd also hope to work with different partners to do this. The partners must not work on our project, but I'm sure that when we also do advocacy, it also draws a lot of attention. And in essence, any partner or even the government that implements to solve any of the problems, at least some credit will be given to us because we were the ones that open the Pandora box for them to see the challenges in the region, right? So I hope that answers the question.
Thank you very much for giving us that insight. I don't know if you can hear the bell tower on the outside that's ringing in the background. I certainly can. So I think that's a sign of the time is sort of ticking down. In Germany, we have a TV show, Hard But Fair, that at the end, all the panelists are allowed to make one very brief statement. So I'd ask you to, to limit yourself to, I don't know, two sentences max. But if you want participants to take something away, if you want to, call on something for people to take away from this session, what would it be? Whoever wants to start, please do. Just, I don't know, 2 crisp sentences of what's your main message, something you maybe want to share that you haven't been able to in the discussion so far. Pauline,
So yeah, thank you, Thilo. If I may go first, I would like just to end again with the call I made earlier on the planning, but indicate that One Health plans and implementing those at country level are going to be a game changer, because WASH and NTDs is also not about humans only. So appreciating this in the wider platform that involves the environment, the animals, and the humans, and then ensuring adequate sanitation for us all. This is going to be a game changer in achieving the goals that we've set for ourselves for human health. Thank you, and back to you.
Thank you very, very much. I see some applause. Who would like to go next with your 2 sentences closing statement? Don't be so modest.
Okay, so okay, please go ahead.
Yeah, please.
Oh, thank you. Yeah, so water it's a human right, and it is our duty to ensure that everybody has access to clean water and also sanitation and hygiene. And I want to also encourage all of our partners and everyone working in this field not to give up hope, and to also let them know that they are doing a job that brings a lot of internal rewards. So keep the good work going, and wishing you the best as we achieve more in future. Thank you.
Thank you so much. Yes, yes, if you've unmuted yourself, please.
Neglected tropical diseases and their consequences for the community can be only prevented with coordination of all relevant sectors and working in a holistic and coordinated manner. This is my message.
Thank you very, very much. Very clear. And Dr. Ayman?
Okay, so my message would be that mechanisms that facilitate intersectoral and multi-actor collaboration can leverage context-related technical knowledge and experience to improve the life-saving outcomes for affected people.
Thank you very, very much to all of you. To our panel, now I see a question in the chat, but as a strict timekeeper, I would encourage you to answer the question perhaps in the chat. So to our panelists, first of all, thank you very much. In the chat, you'll see a question that has been posed, and feel free to answer to that, and then we can, yeah, for everyone to see your impression of the question: has the COVID pandemic influenced national governments to have more focus health per se. If you have or to anyone else in the room, if you feel you'd like to answer there, please do. We can discuss a lot of things, but we must act at the end. And yeah, to improve things, we must move, we must act. So let's end with a call to action. For this, I'd like to introduce to you Nadja Amina Münstermann, working for Deutsche Gesellschaft für internationale Zusammenarbeit, which is lovingly called GIZ. She's an advisor on environment and One Health in the sector initiative on One Health at GIZ, and with a background in international relations, geopolitics, environmental risks, and human security. We hand over to you to tell us what to do. How can we contribute? Please, over to you.
Thank you so much, Thilo. I hope you can all hear me well. Great. All right. So thank you for giving me your attention in the last few minutes of this meeting. It's been a great panel discussion, and we've had a lot of inputs on the challenges facing us in targeting or combating neglected tropical diseases, but also some means on how to do that. But today we wanted to give you the opportunity to learn a little bit more about an initiative that we've launched yesterday, actually, which is a joint call for One Health solutions. We've done so together, partnering up with IUCN and CABI, the Center for Agriculture and Biosciences International. If you can go to the next slide, please. I'll try and keep it brief, given that we're already a little bit delayed and the session is quite late in the evening. All right, so for those of you who have not yet had the opportunity to get familiarized or to learn about Panorama, One Health, and CABI, these are two platforms. So on the one hand, Panorama, One Health, we launched it quite recently this year. It's a platform where we share solutions to facilitate the One Health approach. We have solutions on there that helps mainstream the One Health approach and give us examples about how to best tackle the issues that we're facing today in a preventative manner. And then on the other hand, CABI, which is a very well-known institution, has also recently created a platform where they curate collections of real-life practical examples of One Health implementation. And they also provide a database of educational and practical cases. And these are really an invaluable resource for a broad range of stakeholders, including students, teachers, academics, but other stakeholders, including practitioners as well. So together we decided to collaborate in the spirit of One Health to launch a joint call for One Health solutions. If you could just click on the next slide, please. Thank you. So I know we all have a lot of work to do. So it might you might have the question, why would we do this? Well, as I said, we've heard the need for getting more visibility to end the neglect of tropical diseases. So you can really achieve this by posting your solutions or your lessons learned and good practices on Panorama or on CABI. These platforms also enable you to exchange with other practitioners in the field of NTDs and WASH and One Health. And I think really importantly, it gives you an opportunity to share what you've learned so far with a wide range of global stakeholders who can then take those lessons learned and really implement them in the projects that they are setting up or that they envision doing in future. On the CABI side, it's also an opportunity to get your solutions indexed on Google Scholar. They're then tagged and marketed, and they will be discoverable to more academics. And this really allows you to get more attention focused on NTDs. All right, if you could just click to the next slide, please. In terms of a little bit of practicalities, there's a lot of submission options that are available to you. On the Panorama side, you can submit a snapshot solution. As the name already suggests, this is a short overview of the project that you're implementing and its impacts, and it doesn't take too much time to upload. It's just around 15 to 20 minutes. My personal preference, though, is submitting a full solution, because this really enables the people looking at Panorama, looking at your solution, to understand the details of your project, its impacts, and the underlying context and processes which frame your project. So this is a little bit longer time investment, around 1 to 2 hours to submit a first draft. And then on the CABI side, you have the possibility of submitting a so-called One Health case. This is peer-reviewed and will mostly be used for research and educational processes. Just given the fact that it has a little bit more wording to it, it takes a little bit longer, so around 4 to 5 hours. All right, if you could click to the next slide, thank you. So as I already mentioned, the call for solutions is open now and will last until the 30th of September. In the meantime, we have a explanatory webinar that we'll be hosting on the 14th of September. And here we will just explain to people how to submit a panorama solution or a CABI case and sort of take you through the process and help you should there be any questions. And then once the call for solution is closed, we will be hosting a public virtual event to showcase some of the solutions that we've received. It will be taking place at the beginning of November. And this is really a great opportunity to have a broad reach and to introduce your work to a variety of audiences and stakeholders. If you could just click to the next slide. I'm already done, so I really try to keep it brief. You can find some of the links here, but we also encourage you to visit the Panorama platform or the Panorama page. There you can find all of the details for the call to submitting solutions to One Health. And if you should have any questions in the meantime, please do not hesitate to get in touch with us at the GIZ Sector Initiative on One Health or any other of the co-hosts here today. That's already it from me. Thank you so much for giving me this opportunity to introduce you to our initiative.
Thank you very, very much. We'll make sure to share all of that in the documentation of this session with the film and so on. Obviously, people will hear about it, hopefully, and we'll hopefully see the results in the coming weeks. So finally, as the last agenda point, it's my pleasure to introduce to you Dr. Daniel Eibach, also working with BMZ in the Division 101 Special Initiative Pandemic Global Health, Pandemic Prevention, One Health. He's a senior policy advisor, medical doctor by training with many years of international experience on poverty-associated diseases, amongst them NTDs. And yeah, we'd love to hear what you thought of the discussion, what your takeaways are, and perhaps you can give some guidance and advice to us all. Over to you. Thank you very much. Floor is yours.
Yeah, thank you very much, and good afternoon, everybody. I will keep it brief as well because it's so late already. First of all, yeah, thank you very much to all the panelists for this insight into all your WASH NTDs, One Health projects. It was really great to hear. And I think the discussion has demonstrated quite well that the link and NTD, between WASH and NTDs is actually crucial. And biologically, I think it's very plausible that the WASH will definitely help to interrupt transmission of many NTDs. But what I think is very interesting, I was reading a recent Cochrane review on WASH and soil-transmitted helminth infections, which has shown that it's actually extremely difficult to show real scientific evidence for this link between WASH and NTDs in cluster randomized trials. So why is it so difficult to get to achieve this scientific evidence? I think there's three main reasons. I think when we are applying, with WASH programs, we are applying quite a wide variety of different interventions, from education to construction of sanitation facilities, toilets, washing stations, and so on. And secondly, it's very difficult to assess adherence to those different interventions, and in many scientific studies, it's not even done, the assessment. I actually also are the toilets actually used, which we are building, and certainly in many studies, I think we're not accounting for the long-term effect of our interventions. If there's a 1 to 2 year-long trial, I think it might not get the right result in the end because we're not patient enough. But even without the scientific evidence, this in my point of view, this does not mean that we are wrong linking WASH to NTD programs. You know, I think this was also very clear with this discussion today. But one thing I would like to highlight, we should not stop testing our interventions in more rigorous trials when implementing WASH programs. And I think there's a constant need to evaluate the adherence to our interventions. Yeah, in the end, the more evidence we have, the better we can tailor our WASH interventions to the context in which we are working. And actually, some evidence is already available. I think in the same Cochrane review, it was shown that there is a benefit of incorporating WASH projects and health education alongside mass drug administration campaigns against worm infections. So there is evidence there, and this is actually very relevant for ASPEN program. And I think this brings me to what I said last year in a similar session. I think at the policy level, we need better coordination between WASH and the health sector, as we have shared objectives, yeah, of reaching the most vulnerable populations and achieving sustainable development goals. And from a donor perspective, we have to make sure that our financial instruments actually allow this cross-disciplinary work instead of funding just vertical NTDs or vertical WASH programs. So in brief, I think WASH is one piece in this interdisciplinary NTD puzzle. And I think we need to learn through implementation and behavioral research how this piece of the puzzle has to be shaped kind of to be successful and integrated, to be successful in fighting NTDs. So yeah, with this, I congratulate everybody today for this inspiring project which we have heard of today. And yeah, I'm looking forward to hear more of those in the future. And thank you very much to all of you and participants. Thank you.
Thank you so much, Dr. Eibach, for taking the time and the energy to give us those points. I like your reflection on the sort of missing evidence, and I was going to point to the UNC Water and Health Conference. I think some of us may see each other there on October 27th, when research, policy, and practice come together at a side event on WASH and NTDs. So that's something I think we can maybe post also as a link into the chat. And with that, all that remains for me to do is to thank all the speakers. Thank you for your expertise and your insights. Thank you to the participants who were with us today. We would have liked more, but thank you to those who were there. Thank you very much for your interest, time, and engagement. And the co-conveners, of course, I'd like to thank. It was a pleasure working with you, and particularly Lea, Michaela, Ran, Annette, Johannes, Constanze, and Nadia, all those faces behind the scenes that put things together. Thank you so much. I hope everyone was able to take something away and to learn something, took a little bit of inspiration and motivation away to join forces in this effort. Please do participate in the joint call for One Health Solutions, and do share when we have the recording and can share it with you, so that we can reach out to more with what we discussed here today. Thank you so much. Have a wonderful day.
Thank you very much.
Thank you. Bye-bye, everyone.
Thanks.
Thank
you. Bye.
Thanks, everyone. Bye.
Thanks. Bye.
Bye.
Bye.